I'm Dr. Christina Lehman. I am a primary care physician and breastfeeding medicine specialist in Columbus, Ohio. I trained as an internist and pediatrician. I'm a fellow of the Academy of Breastfeeding Medicine. And you may know me more as the executive director of Dr. Milk or the vice president of the North American Board of Breastfeeding and Lactation Medicine. Today, we are talking about some technology and resources for breastfeeding and lactation medicine. Our objectives are to review physician-level sources of information, to review evidence-based patient-level resources for support, to identify sources for continuing education and ongoing case management practice support, and then to compare some different pathways to certification. So where do we start, right? There's so much stuff out there. As I mentioned, there's Dr. Milk. iAble does a lot of physician-level teaching, but there's also Gold Learning and lactation education resources. There's different state-based coalitions. There's the Academy of Pediatrics Society or section on breastfeeding medicine. And of course, Academy of Breastfeeding Medicine has their protocols and different courses, like what every physician needs to know, and the annual conference. So where do you start? What do you look at? Where do you go? So take inventory of what you do already have. Are you starting from the beginning, or are you trying to fill in some gaps? What are your goals? Is it mostly just for personal knowledge? Do you want to improve your day-to-day care of patients? Do you want to do specific breastfeeding visits? Do you want to be a breastfeeding and lactation medicine physician and specialist? So what are you looking to do? And that will help guide you on what you're looking for and where you'll get it. But don't forget the clinical hands-on aspect, right? You can learn a lot of things online. You can learn a lot of things by going to courses. But really, when it comes to lactation, you really got to get in there and get that clinical hands-on experience as well. When you're looking at case management, there's a couple different things out there. There's Doctors Practicing Breastfeeding Medicine, or Want To, on Facebook. So that's someplace where you can go and kind of talk about, again, how your practice is going or run cases. Dr. Milk often will do those as well. The iAble listserv and my ABM are really great options for listservs to talk about cases. And don't forget, find a mentor. Everybody's out there. We're all friendly. We all want to help. We love to talk about breasts and lactation. So find a mentor, and that will be a huge thing to run cases by as well. Patient education is huge, right? We want to make sure that they've got reliable sources that are evidence-based. So you've got your ABM handouts. iAble has some handouts. I love Katrina Mitchell and her Physician's Guide to Breastfeeding. First Droplets is a great one to send to those first-time parents for their hand expression. Global Health Media, Ready Said Baby has their prenatal curriculum. Kelly Mom does a pretty good job for something that's on the lay people out there, Mother to Baby, International Breastfeeding Center. So these are just a few that you can have in your toolbox for patient education. I do want to just talk really briefly about what are those different levels, right? So NABLM-C is our brand new North American Board of Breastfeeding and Lactation Medicine. So it's just if you're in the US or Canada. Right now, it's just grandparenting in. So it's an exam that gives you a certification that you are at the level of a breastfeeding and lactation medicine physician, specialist, only US and Canada right now. There's, of course, the IBCLC, which sometimes that's good, enough for you to have that higher level of identification, that you really know what you're talking about. You've done that 90 hours of coursework. You've done that, those clinical hours. So that may be just enough for you to supplement where you're looking. And especially internationally, sometimes that is quote unquote enough for recognition that you are at that level. Certified lactation counselors out there, and the certified breastfeeding specialist, that is, just some extra information, right? You have some sort of a credit after your name. But remember, as a physician, you bill as a physician. So you really don't have to have any of these credentials after your name. It really just gives you kind of street cred. What are some other must-haves in your toolbox? You got to have your Infant Risk Center, your eLactantia, Trash the Pump and Dump, LactMed, ReproTox, whatever it is that you go to. You've got to have those places that are giving you that evidence-based information about medications and supplements and things like that with breastfeeding. And again, look for that advice, those support tips, whatever it is that you need. Find that mentor, get into those communities so that you can help kind of build your practice and build your knowledge base so that you can be the best person you can be teaching your patients and those around you about breastfeeding and lactation medicine.